In other news, African healthcare system is on the brink of a collapse. Chronic diseases are rising, tackling infectious diseases that could spread overseas also becoming difficult. And this as Western countries are cutting off much needed aid.
Now, Africa is fighting wars on multiple fronts. West Africa is grappling with a wave of coups since 2020. Central Africa and the Horn of Africa are plagued by armed conflicts in Sudan, Central African Republic, Democratic Republic of Congo, Ethiopia, Somalia. Civil conflicts in Sudan has pushed over half of its population on the brink of malnutrition.
The World Health Organization predicts shortage of 6.1 million healthcare workers in African region. In sub-Saharan Africa, non-communicable diseases including hypertension, diabetes and heart disease accounted for 37% of deaths in 2019, up from 24% in 2000. They are forecast to become the leading cause of death in the region by 2030.
Now, according to Dr. Githinji Gitahi, Group CEO of Health Africa, 50% of all admissions in a typical African hospital are non-communicable diseases, yet 80% of NCD care is out of pocket and the governments don't have money to actually take care of the NCDs.
U.S. funding accounts for half of all development assistance in Africa. Donald Trump had put a 90-day halt to all U.S. aid soon after taking office. But if U.S. turns its back on Africa, the governments in the continent will find it hard to completely replace lost funding. During the first cabinet meet held by U.S. President Donald Trump, Elon Musk, who has been tasked by Trump to cut U.S. government spending, spoke of the pitfalls of his mandate.
Also, we will make mistakes. We won't be perfect. But when we make a mistake, we'll fix it very quickly. So, for example, with USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
While the Ebola funding has been restored, the full impact of aid cuts for other health programs will need to be assessed. Right now, however, it is leaving healthcare in African nations in a fragile state.